Welcome to the Naugatuck Valley family of imaging centers. I'm Bob Gombardo, one of your radiologists and the president of Naugatuck Valley Radiology. Over the last 30 years, we have grown into the largest provider of imaging in the region, with 17 radiologists and over 150 employees dedicated to providing you with the service and quality you have come to expect from the leader in diagnostic imaging.
You may not know this, but radiologists are medical doctors who specialize in the diagnosis and treatment of injuries and diseases. Whether it be X-ray, nuclear medicine, CAT scans, ultrasounds, MRI, or PET scans, our board-certified radiologists must graduate from medical school, pass licensing exams, and then complete an additional 4 to 6 years of training in the areas of interpretation of medical imaging and radiation safety. Most of your physicians at Naugatuck Valley Radiology have completed an additional 1 to 2 year fellowship in areas of expertise such as breast imaging, neuroradiology, or musculoskeletal imaging. Mammography is the process of using radiology to examine the breast and is used as a diagnostic and screening tool. The primary goal of mammography is the early detection of breast cancer, typically through the detection of characteristic masses.
Mammography's been around for a number of years, and it's evolved over those years. Most recently, it took a fairly large leap with the introduction of digital mammography. The image is actually obtained on a computer and displayed on a monitor, which gives us tremendous potential for being able to manipulate the image, change the contrast, focus on areas that we might be interested in. And in many studies, it appears that digital mammography, for these reasons, offers an advantage in terms of diagnosing early breast cancer. Ultrasound has played a role in breast imaging for many years. It has been found that in women with dense breast parenchyma on mammograms, meaning mammograms that look very white, there is a role for ultrasound in that ultrasound has the ability to see things in the woman's breast that might be imperceptible on mammography. Breast MRI is currently an important tool in breast imaging, and it will hold a much greater role as we move into the future. MRI is a very good modality for visualizing the breast, and we're able to detect many things on MRI that we may not be able to see on a standard mammogram.
Magnetic resonance imaging is primarily a medical imaging technique most commonly used to visualize the internal structure and function of the body. MRI provides much greater contrast between the different soft tissues of the body than CT does, making it especially useful in neurological, musculoskeletal, cardiovascular, and cancer imaging.
MRI uses magnetic fields as opposed to CT, which uses radiation to obtain images. In addition, MRI exams tend to last longer, often 30 minutes or longer. The concept of open MRI started to become popular about a decade ago. It provides cutting-edge technology along with patient-centric design. Our new MRI here at Prospect is spacious, quiet, and provides superb images. We are proud to provide this technology to you here at Prospect.
Women's imaging encompasses digital mammography, dedicated breast ultrasound, GYN pelvic ultrasound, CT, MRI, and bone densitometry.
At NVRA, we have one of the area's first women's health imaging centers. We were established in 1988, and we provide comprehensive care for the patient. Not only do we provide diagnostic imaging services, but we also help with patient education and support. As part of our community outreach, we are active in our local cancer centers. We attend bi-monthly breast conferences with local healthcare professionals in order to provide the best and quality care for our patients. We are also active in educational programs and support services at the Cancer Center.
Interventional radiology is a subspecialty of radiology in which minimally invasive procedures are performed using image guidance. Some of these procedures are done for purely diagnostic purposes, while others are done for treatment.
There was a technology that had come to the fore, which was a minimally invasive way to treat varicose vein disease. It seemed to be very much within my skill set of imaging guided procedures, and it seemed very easy to do, very minimally invasive for the patients, minimal pain, and good outcomes. And so in 2003, we opened up the NVRA Vein Center and started to offer very high level vein care. And that starts with diagnosis. Today we have ultrasound, which allows us to map the veins, and I do that personally with every patient that comes through the vein center. Then we have a consultation where the patient and I sit down and we discuss the ultrasound findings, the physical findings, and their history, and then put that all together and determine what needs to be done. At that point, our staff schedules the patients for the procedure. Patients come in for the procedure. It's a very quick procedure. It takes less than an hour. There's no stitches or incision. It's a small puncture made right at the site of the vein in the leg, usually somewhere in the thigh or the calf, and then treated with a laser. Patients recover almost immediately. They're on their feet right away. There's no downtime. Patients will have a little bit of discomfort at the treatment site, but otherwise essentially be symptom-free.
NVRA is committed to bringing the community the highest quality care in diagnostic imaging in our region. Our services include CAT scan, X-ray, nuclear medicine, MRI, and women's imaging. For your convenience, we have 6 locations throughout the greater Waterbury region: Prospect, Southbury, Naugatuck, and 3 locations in Waterbury. Hi, my name is Robin Sills, registered nurse for Naugatuck Valley Radiology Associates. My role is to assist our radiologists to provide the best quality care for our patients. Radiology is more than just images. It's about caring for patients, and patients are people. We realize that people are going to be apprehensive at times. We're here to help you through that process. Our radiologists have put together a team of people to help provide the best quality care possible. Servicing our patients goes beyond our doors. It goes into our local community, where we're part of such organizations as the American Cancer Society, the Greater Waterbury United Way, the local YMCA, and the Healthcare Council of Greater Waterbury, which teams together many healthcare professionals, all there to provide quality care for people in our community. To learn more about the latest in technology that NVRA has to offer or receive a copy of our newsletter, visit our website at www.nvranet.com.